Good afternoon, everyone, and welcome back to Novatek Medical Data Systems Got 15 webinar series, straight and to the fact webinars on Novatek's new disease control and hygiene monitoring software. We are continuing the conversation with part 3, monitoring rooms. My name is Nisa Barkat. I am the Associate Director of Marketing at Novatek International for almost 10 years. And with me on the line, I have my good friend and colleague, Shiva Zaman. Hi, Shiva. How are you doing today?
Very good. Thanks, Nisa. And I'll introduce myself as well. I'm Head of Product Specialists and Training Services at Novatek Medical Data Systems and have been with Novatek for a little over 19 years now.
Thank you, Shiva. We are so fortunate to have you walk us through this webinar series. Right before we start, let's go over some quick housekeeping. All our webinars during the series are going to be around 15 minutes or less, and we encourage your feedback and questions in the chat below, and we'll make sure we reply to your questions via email individually. All participants are muted for the duration of our webinar, and last but not least, a recording of this webinar will be provided to those who have attended the series and are registered. So let's get started. Novatek Medical Data Systems, in response to the novel coronavirus COVID-19, we are releasing disease control and hygiene monitoring software, saving patients and protecting healthcare frontline workers through better data collection, analysis, and reporting. Just a quick reminder, 2 weeks ago when we did part 2 and talked about earlier before that, monitoring entrances and monitoring people, and today monitoring rooms. We are still living through this outbreak of COVID-19 and the numbers have increased. Outbreaks are not a one-time event, and being prepared is what we practice at Novatek International and Novatek Medical Data Systems. Public institutions continue to be at high risk, such as hospitals, elderly care facilities, and detecting outbreaks sooner for prevention and faster decision making is what we want to showcase today, and we will be doing that with our part 3 series. So I'll now pass it on to Shiva. Thank you very much.
Thank you so much, Nisa. As Nisa mentioned, we are talking about our disease control and hygiene monitoring software today that we call DCH for short. So talking about DCH, I'll quickly go through the workflow or elements of the software application. First, it's early warning and detection with thermal screening, with real-time thermal screening. So we talked about that in our first DCH Got 15 webinar, which will be linked below, so you can click on that and watch that video, and it explains how thermal cameras will monitor incoming traffic into the hospital, both for fevers as well as high traffic counts, to give you alerts when higher than normal populations are coming in order to take action. Furthermore, DCH focuses on data collection and monitoring of viral and microbial contamination on different in different areas of risk. So basically personnel and PPE of locations and rooms, as well as critical equipment. We'll talk about that further. It is a system designed for early detection and early identification. So early detection, coming in real time as soon as the data is available, and providing warnings through the system, as well as early identification due to the extensive analysis and trending that's available on various parameters that could help cause and control outbreaks. And then that enables decision makers, of course, to rapidly respond, to prevent, to control, and to take action when dealing with potential contamination or proliferation of pathogens and viruses throughout the facility, and to be able to then in future prevent those risk areas or sources of contamination in order to contain infectious disease, but also could be bioterrorism agents. And finally, historically, through data, we do artificial intelligence and predictive analytics in order to identify potential risks in the future. So just to go over the 4 main risk areas that DCH looks at and controls and manages from A to Z. One is monitoring of entrances through thermal screening. So what's nice about this is it's a completely automated process. Aside from setup, it doesn't really require human interaction. We're just alerting you if you get above normal, above limits of people walking in with a fever, or just a higher traffic count in general, could be due to accidents or as well an outbreak. So the limits are set by you. It's all automated. It's a great system. More on that in the webinar that's already available. Finally, we have monitoring of people, and that's also available, our Got 15 webinar and that as well. So you can watch that and see how DCH enables the monitoring of personnel, of staff, and including equipment such as PE, and determining the cleaning effectiveness of those equipment. Today we'll go through monitoring of rooms, and this is basically to leverage sampling that you may already be doing or routinely done at hospitals, which includes sampling with swabs, dip slides, contact plates, sponges. So the idea here is to maximize and leverage that effort, being all an essential system that's controlling that and ensuring that that's done really in the high risk areas, and that's done strategically to verify cleaning effectiveness, to verify training, to verify changes in procedures, and ensure those are put in place in such a way where outbreaks are controlled. And then we will look at a case where there's proliferation in a common area. In our scenario or case study, it is through an emergency room, and determining then cleaning effectiveness in that area. And finally, we'll look at how do we identify the source of the contamination as well. Next week, Thursday, August 13th, we'll go through monitoring of critical equipment, including environmental conditions such as temperature and humidity, and water and utilities. As we know, these systems really do allow for the proliferation of pathogens like an HVAC system and whatnot. So as mentioned today, I'll go through 3 areas, just trends and analysis of through the DCH software. And I'll go through an example of the proliferation as well as how we can do root cause in the system. So here in our first graph, we have a line graph here. The software has various types of graphing and analysis. This one is by sample type. So we have in green our swabs, our dip slide, our contact plate, and a sponge. And we've done this every day throughout February of 2020. And you can see we have, peaks, for example, on February 6th of the swab, and we have a second peak on February 11. So as we do, as we change our procedures, as we perform cleaning, we're seeing whether that is effective and whether we're coming back down to acceptable levels through this graph, and to see whether those corrective actions are effective. You can trend by multiple different factors. So you can isolate specific parameters such as a specific area. You can look at specific persons taking the sampling, and we'll get through that through some examples here. So we're basically tracking these outbreaks here and tracking cleaning effectiveness through graphing this, for example. You see our peak on February 6th. This is our similar data here through February, but trended now not by the test type, but rather by the pathogen type. So we're looking at bacteria, virus in green, and yeast, mold in red. And so if you do perform a cleaning, then you can right away see whether that's effective. And by the way, these numbers are, colony forming units or plaque counts that's being trended. And this represents 20 samples a day actually that was taken and added up. Here we're seeing data in a linear regression this time, and it's broken out again by pathogen type, bacteria, virus, and yeast, mold, and in one linear regression. So you can see again when we have our peaks, you can see the slope, the intercept, the number of zero and non-zeros, and the standard deviations, which may help as well establish those limits of when you should be alerted to higher counts. Here we've trended by location, so you can see specific areas, and we've coded them with numbers W1-1, W1-2, etc. And then you can put a description here, so we see, it's the chair in a certain area, etc. When you see those peaks, you can correlate them to basically the effectiveness of perhaps a disinfectant agent that's changing, a procedure that's changing. Have you established a secondary entrance area, for example? Are you screening outdoors, or is that in the screening area, in order to help verify the effectiveness of that through the analysis? Here we're looking at the recovery rate report, which is a total of any non-zero value. So anytime microbials or viral or whatever you choose to trend returns a non-zero result. So that count, plaque count, for example, over the total number of samples we've taken. So the idea here is to really get a complete picture of, for example, viral load in the air, and you may be getting low counts, but you may see that cumulatively over time that might be too high. This is something that would tell you that you might see seasonal patterns or whatever it may be, where you have to put in preventive measures in order to ensure outbreaks, for example, during flu season. So it's a good comparison to see if you are on track with previous years, previous quarters, previous months, or if something has, if there is cause for action and prevention. So here we'll look at a specific case within the emergency room area. So we have an example here, and we have color-coded basically sampling results in green when it was below the acceptable limits set by the user, and then in yellow when we've hit a potential alert. So to be aware and to be tracking perhaps and taking additional samples in the area. And then action required, so perhaps a cleaning is required. You see a lot of those counts are in red right at the entrance of that emergency room. So, does it require a screening area? Do we have to direct traffic flow? Are we seeing this due to an outbreak? Are we seeing numbers due to accidents and whatnot? And so identification of your sampling, pathogen type, as well as numbers, will be able to answer those questions. But we are seeing a visual representation to help you see the actual areas which would require cleaning, and see the problem areas where you may want to increase, for example, the cleaning in those areas. You may miss one, you may see and justify that my cleaning is effective, and just maximizing your program there and having confidence in that, in your cleaning and your procedures of personnel, etc. So you see on day 2, it's proliferated from that entrance area into the triage area, as well as exam room 1, and a little bit in the patient bathroom area there, and it continues into day 3. It continues spreading. So when no cleaning was attempted, or the cleaning was not effective, again, if you're identifying the pathogens, and then you can determine what cleaning agents may be most effective, what procedures of cleaning may be most effective. So otherwise you're seeing that proliferate almost fully into the nurses station and both triage areas, and then it just continues on day 4 to spreading. So how do we identify and assess root cause? So we'll look at an example here, and mainly that's on trending the different potential contamination sources, or areas that may affect contamination to help you determine what that contamination is, both to address and prevent in the future. So here we've done by departments. We're looking at departments. It would be clearly visible all in one color if it was one department and not the other. Here we're looking at specific locations. So the map is helpful for that, as well as you may right away see that it's particularly on door handles or what areas. So making sure we target those. By analyst that's handling the sample. So again, this may be something that could be corrected during training. In terms of monitoring of personnel, that is something we covered in the Got 15 Part 2, so you can watch that. But this is specifically the analyst who's doing your dip slides and swabs and contact plates and whatnot. So you see the count for Karina is pretty high. We perform then training, and then it goes back down. Maybe there's one more incident. So just dealing with that. It could be shifts. It could be something that's happening specifically on a night shift, or morning shift, etc. So is there a correlation to the shift? And then very important, what pathogens are we dealing with? So identifying and trending those. Some of them may not be harmful. Some of them may indeed be very difficult to clean and get rid of. Some of them may infect the HVAC systems, which we'll talk about next week. So really looking at what type of pathogen we're dealing with. You can also trend those. Here we're trending our viruses. You may look at them in a pie chart just to see the percent of distribution of those pathogens. So you may have a normal distribution of microbials, but you're looking at certain viruses that are higher or lower. And then finally, the prevalence. So the prevalence is one thing that will help identify the need for setting alert and action levels that are really specific to your facility, your hospital, and your process. So here we have a really high count of 0. So we're doing pretty well there. And then I see my upper warning limit, my upper control limit, which is my second and third standard deviation. And gives me an idea of what I should be setting my limits at in order to be alerted at the right time. So just an overview of what we looked at. So we looked at, went ahead one. So we looked at monitoring routinely, but in terms of high risk areas. So we're mapping, we're determining high risk areas, and then we're maximizing our efforts in order to deal with the high risk areas and leverage the work that is done to ensure we are managing outbreaks. The system provides early detection of problem areas and prevents pathogen proliferation before it becomes an issue. So we're visually tracking and trending those high-risk areas. We're looking at the flow of spread, what areas would be most likely to be effective in order to ensure cleaning effectiveness of your locations. And then when we do have an issue, we are able to drill down by potential contamination causes, locations, look at maps, look at analysts dealing, look at cleaning agents, look at shifts, look at anything that may help you make timely decisions and rapid response to a potential outbreak. So really maximizing those resources. We know they're all tight, and we want to maximize that to ensure you're keeping your personnel, visitors, and patients safe within the hospital. And that can often be done just through some analysis of my cleaning agents, of my cleaning processes, of my traffic flow, of my personnel training, and whatnot. So I will pass it over to Nisa, but we do have a webinar next week as well to look at critical equipment, environmental conditions, and water and utilities.
Shiva, thank you so much for part 3, monitoring rooms. As you can see from all the parameters that Shiva discussed on how to trend and what to trend, it is a multifaceted dimension of trending that could really help with what Shiva mentioned was timely decision making to prevent outbreaks in our healthcare facilities. Please take note of our contact information below, everyone. We would love to hear from you, whether it's on LinkedIn or if you have any questions and comments, or if you would like to see a full demonstration of the disease control and hygiene monitoring software. We will see you all here next week, Thursday, August 13th, when we go over story number 4, monitoring equipment and utilities. Thank you for your time, Sheba, and thank you everyone for your time as well for our GOT15 webinar series.
Thank you, Nisa.